Hello, I'm Bethany, and I am the Rise Vermont Program Manager for Orange County. Thank you for joining us for the Rise and Walk virtual edition. Through Rise and Walk, Rise Vermont is encouraging Vermonters to walk for 30 minutes, 3 days per week, and we will also be hosting health talks along the way. With me today is Dr. Paul Smith. Dr. Smith is a foot and ankle surgeon who specializes in podiatric sports medicine and reconstructive surgery in Gifford's Health Center. Welcome, Dr. Smith.
Thank you very much, Bethany.
We're going to start with a few questions today. What type of symptoms would lead someone to see you for care?
Well, most often people are going to see us for either acute or chronic problems. Acute problems being sprains and strains. More chronic issues could be arthritis or something called tendinopathy, where you've had a tendon injury for a long period of time, or a progressive flat foot that we have to deal with either conservatively or with surgery. So we have a myriad of different things that we're seeing, but they usually fit into one of those categories, either acute, chronic, or structural.
Great. How do podiatrists help people achieve their fitness goals?
Well, we usually start by trying to look at proper foot mechanics and proper walking or running mechanics, depending on what their sport is. We look at their shoes and try to figure out what's the best shoe for their foot type. Everyone seems to have a different type of foot. Some people are very flat, some people have a high arch foot, and their choice of shoe gear are going to be completely different. So we kind of tailor our treatments according to not only what their foot type is, but do they have any mechanical faults with their walking, or do they have any weaknesses that they don't know about that we can assess with physical therapy? Or if they do have a structural problem, how do we assess that with arch supports or even custom orthotics?
Perfect. What would you say to someone who has a foot or ankle issue but's been putting off seeing a podiatrist?
Well, we definitely find that dealing with the acute issues are much easier than dealing with a chronic problem. Acute issues, a lot of times we're just dealing with that one problem. When they come in with a chronic issue, they've had something for a long period of time. Those things don't usually improve very well with conservative management, and they've also developed compensatory problems. So now instead of one issue, they're coming with one major issue and 3 or 4 compensatory problems that we have to deal with. It's a lot harder to deal with. So if we catch it early, it's a lot easier for the patient. They get better quicker and they have a better outcome.
Great. Do you have any foot gear recommendations for walkers?
Walking shoes, typically like a normal running shoe, because it seems to put the foot in a good position for walking. There are shoes that do have a bit of a rocker built into them, so that works well for walking, especially with people who have arthritis issues with their foot. And then again, we kind of tailor the shoe to the person. So running shoes tend to have shoes designed for people with flat feet, and also shoes designed for people who have high arch feet. So they're kind of a different shoe. High arch feet, you're looking for more cushion, whereas someone who has an arch collapse is looking for more structure and a little bit more stability in the shoe. So we can tailor the shoe choices to the patient for this specific activity.
Great. And how often do you recommend people replace their sneakers?
If they're running, then usually it's the gold standard is about 300 miles. If they're walking, especially in the North Country where you have a lot of seasons where you're not doing a lot of walking, you can probably get 10 months to a year out of a pair of shoes. And usually that's about the time we tell people just to change them out every year or so.
Great. Well, thank you so much for being with us today. We're pretty much out of time, but we really appreciate you sharing your knowledge with us, and hopefully this helps some folks get back out on their feet. So for additional information on the topics that we discussed today, go to the Rise and Walk page at risevt.org, and remember to rise and walk 30 minutes a day, at least 3 days a week.